Hello guys, I welcome all of you to the recall series of NEET PG 2022 exam. And let us quickly brush up with the questions which were asked, the topics that you can look at the questions which are asked, and what are the probable answers. Now, the question first one, guys, which of the following drugs is not associated with pleural pathology, right? Now, first of all, I'd like to tell you something. These are uh, these kind of MCQs. They're one-off MCQ. They'll be asked once and they'll never be asked sometimes. So, if in your exams you're not able to answer such questions, right, you should not be worried. These are not the rank decider question, one-off questions, right? So they should not make your confidence level low or down. But anyways, has been asked. What could be asked in future? Let us see. Now, let me tell you here something. See, drugs causing pleural pathology, these are mostly ergot derivatives. So at least try to remember the ergot derivatives. What drugs we have? Bromocriptine, cabergoline, ergotamine, methysergide. These can cause. Nitrofurantoin can also cause. So if we rule out, what we get is metformin. Now, many of you had gone for the answer. The students told me they went for metformin with a hunch, because nowhere in metformin we have read about that it causes some pulmonary pathology is not seen. Metformin causes vitamin B12 deficiency or lactic acidosis. So if you have got such a hunch for questions, you can go for the answer. Sometimes that gut feeling that we get is the right answer. Next question, guys. A patient of diabetic ketoacidosis and hyperkalemia, DKA hyperkalemia, which of the following will shift potassium back to the cells? Is it glucagon, epinephrine, atropine, lactic acid? What will be the answer? It's a very simple question, guys. If you have understood the receptors, I told you receptors are important to solve different MCQs. So if you remember beta 2 receptors, I told you beta 2 receptors, we discussed, they increase insulin and that decreases potassium level. Now, even if you knew this much, you could have answered. Apart from that, beta 2 receptors, they also activate sodium potassium ATPase pumps, which are present in your skeletal muscles. And in a sodium potassium ATPase pump, they throw sodium out of the cell, skeletal muscle, into the cell, potassium is thrown. So, if you know this much, that beta 2 receptors moves potassium into the cell, then you could have answered this, that now the ball is in your court, guys. Tell me, what is the answer? Indirectly, which one stimulates beta 2 receptor? Your answer is epinephrine. So it's not a difficult one. See, a lot of times you have to manage the answer correlating the different concepts. A patient consumed 8 tablets of digoxin 0.25 milligram tablets. It develops heart block plus heart rate of 56 because of obviously conduction block. Bradycardia is seen. Which of the following would be best management? Right? Best management. Cardioversion, lidocaine, phenytoin, digipine. What is the answer? Think about the answer for a while in your brain. What is the answer? Now, if you think lidocaine or phenytoin could be the answer, because we have talked about lidocaine being used, phenytoin being used in digoxin-induced arrhythmia. But where is it that we use them? Let us see. If you see digoxin toxicity, you know that digibine is the answer. So here the answer is digibine. While lidocaine or phenytoin is not the answer because they are used in VT, ventricular tachycardia. And look at the question. Are we having any ventricular tachycardia here? No, it is bradycardia, right? We'll not use them. Then what about digoxin use in cardioversion? See, digoxin sensitizes heart to electrical stimulus. And there is a reason why cardioversion, it can worsen arrhythmia due to digoxin, right? So if it is life-threatening ventricular fibrillation that is seen, then in that case what we do, we give lidocaine first and then we give cardioversion, right? So cardioversion, usually it is not given to patient. If it is life-threatening ventricular fibrillation, then we can give cardioversion, but before that preload lidocaine. Otherwise, remember, cardioversion can worsen digoxin-induced ventricular tachycardia. So these are all out. My answer is digibine. So I've told you time and again, you should have one page where all the antidotes should be written, right? Next question. A patient of cisplatin-induced nausea vomiting, injected antiemetic, developed dystonia and Parkinson's disease like fracture. So tremor, bradykinesia, and dystonia means an abnormal posturing was developed. Which of the following drug was injected to the patient? So basically, they are asking you that metoclopramide, the drug here, the antiemetic is metoclopramide, is causing this question, and the reason being it is a D2 blocker, and being a D2 blocker, and because it crosses blood-brain barrier, this is the reason why metoclopramide is the answer here. They ask you treatment. Treatment is mostly they give you in options benzaxol. If it is not in the option, they give you promethazine. Can be used for treatment. So this is a case of EPS, acute dystonia Parkinsonism developed due to antiemetic metoclopramide. It crosses blood-brain barrier. Domperidone, it is also a D2 blocker, but it does not cross blood-brain barrier, right? Next, which of the following is a growth hormone receptor antagonist? Now guys, this is a very simple answer, simple question. Such questions you should not take more than 5 seconds to answer, so that the remaining time you can reutilize for some other questions which are difficult. Growth hormone receptor antagonist, guys, all of you know it is pegvisomant, and it is used for treatment of drug-resistant acromegaly. Acromegaly, my drug of choice is in acromegaly. My drug of choice is, all of you know it is octreotide, and there is no response, then I go for pegvisomant. What is the side effect of pegvisomant? They can ask you. It causes what? Pituitary adenoma, right? Now next question, a patient is given anticoagulant for prevention of DVT. It develops following symptom in the image. Which anticoagulant he was started upon? Now you can see here, what is the color? Some would say purple, some would say blue. Right, mostly boys would say blue because for us, every purple is blue. Right, so purple or blue discoloration of the feet. Which drug can cause this? Now look at this. Warfarin can cause purple toe syndrome. And what is the reason? The cause is because of cholesterol microembolization of the lower limb. So the cholesterol that is present in the atherosclerosis, they're broken down by warfarin, and microembolization of the smaller blood vessels in lower limb, it can cause purple discoloration. These purple lesions which are seen, they are painful. They're very painful. They are bilateral and they blanch with pressure. Right? When we press, they will blanch. They are seen usually after 3 to 8 weeks after surgery. They are seen usually 3 to 8 weeks after surgery. So here, your answer, as all of you know, is warfarin. This is purple toe syndrome. The next question, guys. Which of the following is drug of choice for paracetamol poisoning? What did I say? Antidotes. Keep writing antidotes separately in one page. And antidote of choice is N-acetylcysteine. We have discussed this. Is a drug of choice for paracetamol poisoning. If the patient does not respond to N-acetylcysteine, then the patient develops what? Fulminant liver failure. Then what is the only thing I can do? Emergency liver transplantation. Right? Which is the most common cause of drug-induced liver failure? Paracetamol or acetaminophen. Next, which of the following drugs is used in opioid poisoning? This is the third antidote in a row in one exam. Third antidote, opioid poisoning. Your answer is what? Naloxone. So opioid poisoning, naloxone is the antidote of choice. There is nothing much to explain here. Naltrexone is not used as an antidote. And acetylcysteine, it is used in paracetamol poisoning. Alvimopen, it is used in post-operative ileus. It is an opioid antagonist, right? Which of the following is a PCSK9 inhibitor? It's a very simple question, guys. Evolocumab. There are two of them, evolocumab and alirocumab. We have discussed this in our lectures. These are PCSK9 inhibitors, and these drugs, they are used as add-on to statins. They are used as add-on to statins, and these are the drugs which cause maximum decrease in LDL is caused by these drugs. Now in these maps, you can see the alphabet C here. It tells her C for circulation. C for circulation, right? Next, a patient of TCA toxicity develops toxicity with wide QRS complex and right axis deviation, what is used for treatment? This is the fourth question in one exam for antidotes, right? So arrhythmia, basically TCA causing arrhythmia. What is the treatment of choice? See, tricyclic antidepressants, they have quinidine like effect, and quinidine causes QT prolongation or torsades. Quinidine causes QT prolongation or torsades, and for this arrhythmia that is seen here, the drug of choice is bicarbonate. So answer is sodium bicarbonate. So remember guys, if they ask you TCA toxicity or antipsychotic toxicity, both typical, atypical, your answer would be sodium bicarbonate, because there can be QT prolongation, torsades, patient can die because of that, right? Sodium bicarbonate is the answer. A pregnant female with UTI due to gram-negative bacteria started on antibiotics that cause tendon rupture in the baby. Mechanism of action of the drug is, see, tendinitis or tendon rupture is a side effect we have discussed with fluoroquinolones. Plus, they can cause cartilage growth defect. So that is the reason why they should never be given to a female, pregnant female and young children. And fluoroquinolone, how do they act? Yes, they act by blocking what? DNA gyrase. So as answer here, B, DNA gyrase inhibitors. So next question guys, mechanism of action of botulinum toxin. It's a very easy one guys. What it does, it blocks acetylcholine release. Right, so they act upon release of acetylcholine, and by decreasing acetylcholine release, they will decrease muscle contraction because of decreased action on NM receptor. And that is what they're used for different conditions which we have discussed, like to remove wrinkles, achalasia, dystonia, right? So it's a very simple question guys. Next, a female presented with headache associated with photophobia and phonophobia. Which of the following drugs can be used for immediate relief? So what is this diagnosis? The diagnosis is what? The patient is having what? Acute attack of migraine. So they're asking which is used. It's a simple question, guys. It's simple. It's a very simple question. Your answer is sumatriptan. The other drugs here, they're used for prophylaxis of migraine, not for treatment, right? Sumatriptan. A person comes with rigidity, tremor, bradykinesia, masked faces. Diagnosis, PD, Parkinson's disease. Which of the following drug would be used in treatment? What is the answer, guys? Answer is what? Selagelin, which is a MAO-B inhibitor. Others are not as a clozapine is antipsychotic, donepezil in Alzheimer's, haloperidol in psychosis, like clozapine. So again, this is not a difficult question. A patient who started on theophylline for treatment of asthma, which of the mechanism is diuresis produced by theophylline? See, theophylline is a drug which has multiple effects. Adenosine receptor block causes seizure, arrhythmia, and diuresis. Phosphodiesterase 4 block causes headache and GI abscess. But arrhythmia is due to both phosphodiesterase 3 block as well as adenosine receptor block. So see, this topic is frequently asked. So these things, they'll be commonly asked. So what is the answer here? Go back to the question. Your answer is A1, adenosine receptor block is responsible for diuretic effect. Right, 10-month baby presented with Hibs arrhythmia with salam spells. The drug of choice is, see, Hibs arrhythmia in EEG and salam spells. They're characteristic of infantile spasm. And what will be discussed? What is the drug of choice for infantile spasm? It is ACTH. So you just have to make a simple diagnosis, go for the answer ACTH. If it is associated with tuberous sclerosis, then we go for vigabatrin, right? Which of the following drug is used for treatment of acromegaly in a patient unsuccessful surgical remedy? See, acromegaly, first of all, we will do surgical remedy or surgical treatment, right? And if the patient does not respond, then I go for drugs which are somatostatin analogs, and the only one here is octreotide. If the patient does not respond to octreotide, then I can add pegvisomant, which is a growth hormone receptor blocker, right? A patient with bloodstream fungal infection shows dimorphic features like yeast at 37 degrees, mold at 27 degrees, and had a red pigment around its growth. Identify the organism and drug used for treatment. See, this question is a difficult one. If you could not have solved, then it is okay. It is pardonable. It's a mixture of micro and pharma. So if you look at the microbiological aspect, this fits with an endemic mycosis called as Talaromyces, for which the drug of choice is amphotericin B, right? So if you are not able to solve such questions, these are on the difficult side. These are the questions which are integrated, micro and pharma. If you know micro, you have to also know pharma, then only you can give the right answer. If you don't know any one, either micro or pharma, then you are gone with such questions, right? So amphotericin B Talaromyces is the best answer here. A female developed hyperprolactinemia, galactorrhea with recurrent episodes of nausea, vomiting. MRI shows pituitary adenoma. Test was negative, pregnancy test. She did not give consent for surgery. Which drug should be used for management? Now see, what's happening is a case of hyperprolactinemia. And hyperprolactinemia, we use D2 agonists like bromocriptine and cabergoline. And out of these, we have one drug here, bromocriptine, which will be the answer here because we are dealing with hyperprolactinemia. A patient was diagnosed with TB and was started on first line drugs. After some time, he developed tingling and numbness in the limbs. What should be given to prevent these symptoms? So what should be given to prevent these symptoms? So first of all, which drug has caused these side effects? Which first line drug? Isoniazid. Why? Because it decreases what? Vitamin B6. And decrease in B6 decreases what? GABA. That is the reason why we are having these side effects called as neuropathy. What will I give back to the patient? Obviously what? Vitamin B6, isn't it? Multi-drug resistant TB refers to resistance to, your answer is isoniazid and rifampicin. This is frequently asked. So MDR is this one, whereas XDR is resistance to H plus R plus fluoroquinolone plus at least one injectable like aminoglycoside. This is XDR TB. So MDR, XDR, it should be on your tips. Now moving on, next question guys. A patient of obesity is on treatment by a drug that inhibits lipase. So lipase inhibitor, the drug is called as Orlistat. He gives history of bleeding and stool that sticks to the pan. Which of the following vitamin deficiency can cause these symptoms? See, Orlistat is a lipase inhibitor, and that is why it can decrease absorption of vitamin A, D, E, K. All of them are in the options. Which is the better answer? See, here there is a history of bleeding, and bleeding can be because of deficiency of which vitamin? I mean, again, guys, this is not a very difficult MCQ. Your answer is vitamin K, because vitamin K is required for coagulation factors 2, 7, 9, 10. Deficiency of those factors, it has caused bleeding here, right? Now coming to the last question here, guys. Primaquine is an anti-malarial drug that can precipitate hemolysis. This effect is related to which enzyme, right? Now again, this is a question that is a hybrid question from biochemistry and pharma. So primaquine can cause hemolysis. It is a known fact in pharma. They're asking you in biochemistry, what is that causes hemolysis? Which shunt is responsible? Your answer is HMP shunt, right? Because HMP shunt, I need G6PD. See, hemolysis is seen in G6PD deficiency, and G6PD is important for the HMP shunt. HMP shunt primarily, right, via NADPH. It is responsible to produce antioxidant effect. Some drugs are oxidant, like primaquine, and that oxidative stress can cause hemolysis. So HMP shunt is a better answer here. In biochemistry, you can read that how HMP shunt is important for antioxidant effect with the help of G6PD. So answer is HMP shunt. So it is primarily an MCQ of biochemistry. right? Something related to pharma, but I decided to cover this as well in case it is not covered in biochemistry. So you can see here that most of the MCQs in NEET PG, last NEET PG 2022, the MCQs, most of them, they were on the easier side. 2-3 questions were difficult, but that is okay. Every exam will have some questions which are difficult. Otherwise, what is the credibility of the examiner if you could answer all the questions, right? What is the joy of the examiner? Right? You have to give him some joy as well. So, guys, you can see here in this one question paper we had four antidotes of choice. So I keep on telling you time and again, keep writing the drugs of choice, antidotes of choice separately, and keep revising them frequently. Every day at night before going to sleep, you can revise at least 5 drugs of choice or antidotes of choice. Keep repeating that so that by the time of exam, those drugs of choice, antidotes of choice, they should be on your tips. All the best, guys. This was Dr. Ranchan with you, your pharmacology faculty in Mero.